Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the special investigations which are related to cornea? The investigation which is pachymetry will measure the thickness of the cornea. So, thickness of the cornea is measured by the pachymetry, whereas spectral microscopy will evaluate the corneal endothelium. Then we have keratometry will evaluate the curvature of the cornea is evaluated by the keratometry. Then we have keratoscopy or placido disc or topography which detects the abnormalities of the corneal shape. Then we also have some vital stains are also seen, like rose bengal stain will stain for corneal stain defects. Corneal defects are stained by rose bengal stain, whereas fluorescent stain will stain the corneal defects. Corneal defects are stained by fluorescent stain. Fluorescent stain will stain the corneal defects, whereas the rose bengal stain will stain the mucus and dead cells. So if you see the pictures, so this is the specular microscopy and these are the endothelial cells. So this is specular microscopy. Then for knowing the anesthesia of the cornea, we have aesthesiometer is present. So this aesthesiometer is also important. So this is the picture of aesthesiometer. So these are the investigations of cornea.
thank you and thank you for watching.